Assalamu alaikum. This video is about carpal tunnel syndrome. First of all, we will check what is the definition of carpal tunnel syndrome. Carpal tunnel syndrome is pressure on a nerve in your wrist. It causes tingling, numbness, and pain in your hand and fingers. You can often treat it yourself, but it can take months to get better. Basically, CTS is due to pressure on nerve, which causes disruption of blood supply and results in pain. Along with pain, it also causes numbness and tingling, that is again due to compromised blood supply. CTS is caused by pressure on median nerve that passes through this compartment of carpal tunnel and causes pain. This median nerve runs from forearm through carpal tunnel to the hand. It sends sensations to palm side of the thumb and fingers except the little finger. The symptoms include pain, numbness, tingling, weaker grip, and due to this weaker grip, it will increase the tendency to drop the things. Now, this slide is showing the compartment through which the median nerve is passing. After causes and symptoms, we will check how to diagnose CTS. CTS can be diagnosed by nerve conduction velocity test. The nerve conduction velocity test is one of the most dependable ways to diagnose carpal tunnel syndrome. By measuring how fast an electrical signal travels along the forearm's nerve or from the nerve to the muscle, this test can produce reliable evidence of the syndrome. So, by this nerve conduction velocity test, the velocity at which the nerve is conducting impulses can be checked, and the working of nerve can be checked also. It will tell the tendency of the nerve as well. After diagnosis, for further perfection, assessments can be performed. This assessment includes some tests by which CTS can be showed. For assessment of CTS, three tests can be performed: Tinel's test, Phelan's test, and Durkin's test. Moving towards how they can be performed, for Phelan's sign test, you hold your hands in front of you and then flex your wrists, letting your hands hang down for about 60 seconds. If you feel tingling, numbness, or pain kind of sensations in the fingers within these 60 seconds when you are performing this maneuver, as shown in the figure, you may have carpal tunnel syndrome, or you can say that your Phelan's sign test is positive. Next is Tinel's sign test. In this test, you have to tap at the carpal tunnel compartment for about 3 to 5 times. It will cause tingling sensation to radiate through that area of the pain. If the feeling is like pins and needles, then it will show that the Tinel's sign test is positive. Then it comes Durkan sign. For this test, you have to press over carpal tunnel compartment and hold for 30 seconds. It will cause pain in the area and shows positive sign of Durkin test. Once it's confirmed that it's CTS, then we will move towards the treatment. For electrotherapy, two main modalities are used for CTS, but there is one other kind of modality that is known as ultrasound physical therapy that is also effective for CTS treatment. TENS and heating pad are explained in the next slides. So this slide will explain what is TENS and how it will help to recover from CTS. The image is showing the placement of pads of TENS modality on hands. This TENS and EMS, that is electrical muscle stimulator, treatment work to manage pain and discomfort, such as the kind felt from carpal tunnel because of how TENS and EMS disrupt the pain signals. Whenever a TENS device is activated, it sends the vibrations, it sends the pulses up through the nervous system, and this is how it mimics those pain signals coming from the nervous system. Then comes the ultrasound physical therapy. The picture is showing how and where to apply ultrasound probe. The ultrasound machine works by sending an electric current through crystals found in the ultrasound probe. The probe vibrates, causing waves to travel through the skin to the body underneath. The waves transfer energy to the tissues to cause the desired effects, and the ultrasound can also be focused on tissues deep within your body without affecting other tissues close to the surface. This is how this ultrasound machine works. But the advantage of this ultrasound physical therapy is that the heating effect that is produced by ultrasound helps to heal the muscle pain and reduces the chronic inflammation. Heat therapy is another effective treatment option. Not only it does increases the blood flow and it relaxes the tense muscles, but many of the pain management specialists believe that heat therapy may help restore the damaged tissues over time and provide long-term results from carpal tunnel pain. After electrotherapy, manual therapy is required. Manual therapy techniques include soft tissue and carpal bone mobilizations, like soft tissue mobilizations and carpal bone mobilizations, and also the median nerve mobilizations. These median nerve mobilizations will potentially reduce the pressure existing around the nerve and improve the blood flow of the nerve, which will help the nerve heal and improve the CTS symptoms. This slide is showing the exercises that can be performed by physiotherapist and the patients by himself at home 3 to 4 times a day. The image is A is showing flexion of the wrist, B is showing extension of the wrist, C is showing ulnar and radial deviation of the wrist. These are the active range of motion exercises for the wrists. Next, you can perform the wrist stretches also. That includes the upward stretch and the downward stretch, as you can see in the picture. Then next, the tendon glides can be performed as shown in the picture. The patient can perform the wrist flexion exercises by holding anything or any kind of weight in the hand. Like for example, you can take a ball in the hand and can perform the exercises. The patient can perform by himself as well. By holding the same object, wrist extension exercises can be performed as shown. The most important exercise for CTS is grip strengthening exercises. As we have read in the symptoms of CTS, that the median nerve damage or injury can cause weaker grip, and the tendency of the to drop the objects will increase. That can by performing the grip strengthening exercises in this way 5 to 6 times and more in a day, it will improve the condition of CTS. So this was all about the carpal tunnel syndrome. For more videos and customized videos or the videos on the topics that you want us to make for you, you can tell us in the comment section. And do subscribe this YouTube channel.